In this short video, we will be looking at the pathophysiology of rheumatoid arthritis and the pharmacology used to manage the condition. Bullock et al. 2021 states, rheumatoid arthritis is a chronic inflammatory disorder that affects the synovial joints. It is identified as an autoimmune disease with complicated interactions within the immune system that is still not completely understood, meaning a full form of treatment is not yet established. Rheumatoid arthritis being an autoimmune disease essentially means it mistakenly attacks the body's own tissues. The precise cause is not understood, however genetic predispositions and environmental factors are likely triggers. The immune deregulation due to a combined network of cells, inflammatory components, degrading enzymes and angiogenetic factors are vital features of synovial inflammation. Following the triggers that initiate a response, the illness develops as a consequence of interactions between cells within the joint called fibroblast synoviocytes. The innate immune system, including macrophages, dendritic cells, neutrophils, and mast cells, as well as the adaptive immune system, which are T and B lymphocytes, collectively cause inflammation and pain. Bullock et al. 2021 further explains, when the B cell is activated, autoantibodies like anti-citrullinated protein antibodies, ACPA, and rheumatoid factor, RF, are emitted and convoluted with immunoglobulins like immunoglobulin IgG or IgM. T-cell activation is then stimulated from autoantibody synthesis that results in the synthesis and release of pro-inflammatory cytokines like IL-1, IL-6, and prostaglandins, which can be depicted on the left side of this diagram. Macrophages can be absorbed into the synovial fluid as a result of the pro-inflammatory cytokines, which causes white blood cells like T cells, mast cells, neutrophils, and dendritic cells to be attracted to the area and promote angiogenesis. The mast cells and neutrophils absorb the immune complexes and release enzymes that break down the synovial and joint tissues. The synoviocytes can be identified as macrophagic type A cells or fibroblast type B cells. They promote synovial hyperplasia, which is the increase in number of cells, and with the simulated angiogenesis form pannus, which is a fibrovascular tissue. Moreira 2021 demonstrates the inflammatory disease evidently leads to synovitis and progressive destruction of the affected joints as depicted in this image. When both type A and B cells generate the production and excretion of matrix metalproteinases, it creates further cartilage damage and subsequent inflammation. Moving on, there are medications and pharmacological methods that can manage the indications associated with rheumatoid arthritis. I will be discussing a common type of medication, which is ibuprofen, and is used to assist this illness. This drug is known as a non-steroidal anti-inflammatory drug and can be classified as an analgesic, which relieves pain, antipyretic, which relieves fever, and anti-inflammatory. Ozan et al. 2019 explains NSAIDs as a frequent drug used to control the disease rather than other medications used to modify it. NSAIDs are beneficial as they provide relief and are not an addictive drug like opioids, to which it does not act on the central nervous system. Hot 2020 describes how the drug is supportive through relieving symptoms like pain, inflammation, and stiffness, as well as improving function and joint mobility. The drug has anti-inflammatory agents that are non-steroidal, which will be further discussed. Brunton et al. 2018 demonstrate how NSAIDs reduce the pain and inflammation experienced through inhibiting the cyclooxygenase COX enzymes, in particular COX1 and COX2. This inhibition blocks and decreases the production and synthesis of prostaglandins, which are the chemical mediators that form and promote the inflammatory response. Mercado et al. 2021 further elaborates on the anti-inflammatory actions. NSAIDs have analgesic, platelet inhibitory, and antipyretic actions. When a tissue injury or inflammation is triggered, prostaglandin synthesis begins through inhibiting the COX enzymes, which convert arachidonic acid to cyclic endoperoxides, as seen in this diagram. These are precursors of the prostaglandins that contribute to the anti-inflammatory effects of the drug. When administering ibuprofen or NSAIDs to a patient, there are various considerations to ensure the safety of the individual and effectiveness of the provided medication. Bertram and Rosenthal 2021 identify strategies to implement when providing NSAIDs to patients. By performing appropriate checks when administering and giving the medication to the individual, as well as educating the reason for the medication, is crucial. This can be incorporated for the care of Margaret, as it ensures the correct patient is receiving necessary pain relief and she understands why. A nurse should also consider the side effects of the medication and whether there are any negative drug interactions that could poorly affect Margaret's health status. This can be achieved through continuous assessing and monitoring of how Margaret feels from taking the ibuprofen. Thank you for watching this video on rheumatoid arthritis.